Zoster, commonly known as shingles, is the painful rash caused by the reactivation of latent varicella zoster virus, and it can now be prevented through vaccination. Understanding the risk factors for zoster has become increasingly important as the high cost of the vaccine means that some countries are having to target it at high-risk groups. Age is by far the most important risk factor for zoster, and therefore countries are tending to focus on older individuals. The other key risk factor for zoster is severe immune suppression. However, these patients can't currently receive the vaccine due to safety concerns. There have been a number of studies recently which have suggested that other clinical conditions, such as diabetes and chronic kidney disease, may be associated with an increased risk of zoster. However, there's currently a lack of large, highly powered studies investigating these associations. Therefore, we aim to quantify the effects of various proposed risk factors on zoster. So how did we do this? We carried out a population-based case control study using the Clinical Practice Research Data Link, known as CPRD. This is an anonymised database of patient records, and it contains data on a very large number of individuals, including their clinical diagnoses and prescriptions. Our cases were patients diagnosed with zoster between 2000 and 2011, and we matched these cases to non-zoster controls on age, gender, GP practice, and zoster date. In order to calculate the effects of each of our risk factors on zoster, we calculated the adjusted odds ratios using conditional logistic regression. If you'd like more detailed information on our methods, please have a look at our paper. So our results. We found over 144,000 cases of zoster, and we matched them to almost 550,000 controls. The median age of our cases and controls was 62 years. Table 1 shows the relative risk of zoster for our key risk factors of interest. We found rheumatoid arthritis, lupus, inflammatory bowel disease, and chronic obstructive pulmonary disorder were associated with over 30% increased risk of zoster compared to patients without these conditions. Asthma, chronic kidney disease, and depression were associated with over 10% increased risk of zoster. We also found evidence that type 1, but not type 2 diabetes was associated with an increased risk of zoster. Our models also included conditions which are currently vaccine contraindications, including HIV, leukemia, and lymphoma, and these were by far the strongest risk factors for zoster. As you can see from Table 2, HIV was associated with a 5-fold increased risk of zoster.
So what we found was that herpes zoster risk is increased in a range of people with conditions such as rheumatoid arthritis, asthma, and chronic kidney disease. What we also found was that the highest risk were among people with conditions such as leukemia and HIV disease, where their immune systems are compromised. This is important because among these very high-risk conditions, we cannot use the vaccine because it's a live virus and is contraindicated. What our study highlights is that among these high-risk groups, we need to find better and alternative ways to prevent shingles being reactivated in people. In terms of limitations and possible explanations for our findings, it could be that people with these high-risk conditions tend to go to the doctor more and are more likely to have shingles diagnosed. This is unlikely to really explain our findings because shingles itself is quite a painful condition. People notice it and they do tend to go to the doctor when they have it. Our study is relevant internationally, and it really shows the power of using people's anonymised electronic health records to answer important questions.